Neurotransmitters, final exam, and VT&E review. So for our neurotransmitters, we have a group of main neurotransmitters, and this first one is called acetylcholine, and this is when we talk about inside out. Bing bong is the one that we use comparison-wise. This is a neurotransmitter at the cholinergic, the rest and relax, also called the parasympathetic system. And this is rarely used in practice. However, some of our drugs will be cholinergic, or some of our drugs may rely on acetylcholine as they get processed. Next up is norepinephrine. Norepinephrine is going to be equal to anger when we compare this to inside out. Basic examples of what happens when we have norepinephrine is the chemical gets released during times of stress. The neurotransmitter comes out during times of stress. We have vasoconstriction, rapid heart rate, and we increase the blood pressure. So kind of like anger with fire coming out of his head, we are increasing the blood pressure. Epinephrine, also called adrenaline, is our next neurotransmitter. This is going to be very similar to norepinephrine, but epinephrine does have a little bit of differences here. And this is going to increase the heart rate as well. It will also increase the cardiac output. And the cardiac output is how successful it is that the heart is going to be beating and working. So it will improve the cardiac output, or how well the blood will pump out blood. The heart will pump out blood. It will constrict and dilate vessels depending on the vessels, and it will dilate the bronchioles. As it dilates the bronchioles, the animal is then able to get more oxygenation in through the lungs and better perfusion. And this we say the equivalent here is fear. For inside out dopamine, we often say sadness. Sadness is going to be a precursor to epinephrine and norepinephrine. So dopamine will be what norepinephrine and epinephrine originate as, and then they will change into epinephrine and norepinephrine over time. This will help be used to treat in practice shock and congestive heart failure. Serotonin is the next neurotransmitter, and we liken that to joy from inside out. This will be used to mediate digestion, memory, and learning. So serotonin is very useful as you are studying right now. This has a calming effect on mood and behavior. GABA, GABA aminobutyric acid is going to be our inhibitory neurotransmitter. Stimulation of GABA is what's going to cause a depressant effect on the central nervous system. And this is the function of how many of our anesthetics are going to work. So when we will anesthetize an animal, we are going to have the inhibitory neurotransmitter acting on the brain. We get a depressant effect on the central nervous system, and the animal should be losing consciousness.